Hi. Of late, we are seeing a lot on social media. Many young people in their early 30s, 40s have sudden cardiac arrest. Suddenly they fall and die. And sometimes it is scary why people are dying. One could be a cardiac arrest, and some people say it's a post COVID vaccination thrombosis effect, and it could be a silent myocarditis, and so on. So this sudden cardiac deaths in young people, especially in India, is alarming and it needs some attention. So why it's happening? What we can do to prevent this? So what has happened is happened. At least what precautions we must take. Young people in their early 30 plus and 40s, so they'll prevent these cardiac risk factors and sudden cardiac arrests. So I made a simple list of a preventive heart screening diet. So this everyone should know for themselves and for their family members. The first thing is if somebody is 30 plus, so don't think that heart disease is already seen in the social media and all. Even people at 30, 35 also suddenly dying of heart diseases. 30 plus, the basic things to be checked at least once in 6 months, once a year. Your BP, blood pressure. Blood pressure is a silent killer. So check at least BP. Even if you don't have BP, check your BP once in 6 months. And if somebody is having a BP, I suggest keep an electronic BP apparatus at home and check weekly once. And some people are very much obsessive and keep checking BP every day, once or twice. Don't do that. At least your BP is fairly under normal. Once a week is enough. And if you don't have a BP, at least make sure that once in a 6 months check your BP. Because blood pressure is a silent killer. Second comes your cholesterol. This is now there in most of the health checkups. At least people who are 30 plus or risk factors, once in 6 months or once in a year, check your cholesterol. And in the previous videos, I made a list what all you look for in a lipid profile report. Second thing is check your blood sugars, FBS, HbA1c at least once in a year. So many people I have seen in a clinic, they suddenly come with HbA1c 9, 10, people in the early 30s. And when I ask them, when was your last blood test done? They say 3 years ago, 4 years ago and all. If you are having mild risk factors also, you yourself feel that you are not maintaining a healthy lifestyle and you are too busy or all those things, check at least once in 6 months or 1 year without fail. Third is ECG. So whenever ECG, just tell about ECG, we cannot diagnose everything. At least you come to know about heart rate, any indirect evidence of heart blocks and all. ECG, whenever you're getting a health checkups, make sure that include ECG also in that. Same thing, 2D echo and TMT. 2D echo and TMT, at least better to get it once in 2 years. 2D echo, basically they say, they do with the probe, it will show the structure of the heart. The heart is enlarged, what is the function of the heart and all. Treadmill test, like you have to run on a treadmill and your ECG and heart rate pattern will be recorded. This treadmill test will indirectly tell you whether you have heart blockages or not. So get this done once in 2 years. And now there are many things, many refined, many advanced things have come. Like a CT coronary calcium score. So somebody is a 40 plus and to know the risk or you're already having a risk factor, there is a test called CT coronary calcium score. This is like a, indirectly I can say this is CT scan of the heart. Here they will see the plaque score, they will make it as calcium score. You need not do any fasting and it will take hardly 5-10 minutes and the risk of radiation also very less. So they do CT coronary calcium score just like doing a CT scan and no injection will be given like a contrast injection and you come to know your score. If it is less than 100, it's okay. If the score is above 100, you have a mild risk. If the score is above 400, then you have a high risk. This high risk is there, either it's just directly go for a CT coronary angiogram or regular coronary angiogram. So what is this CT coronary angiogram? So now it is becoming more and more popular because many people cannot go treadmill test because many have a joint issues. So the modern diseases like many people in the early 40s itself having a joint issues nowadays. Many are obese, they say they can't run. And anyhow, treadmill test given indirect evidence, they don't want to run and see. CT coronary angiogram is give a proper clarity. That means it will exactly show which of your arteries having a blockage. 30%, 40% blockage is there or not. So it will give a, almost a similar report like a normal angiogram you get with a cardiologist. So in this way, CT coronary angiogram is popular. To get a good CT coronary angiogram, the CT scan should be that 125, 123 is the minimum. So many people, many diagnosis centers have a normal CT scan of 30, 64 slice CTs. So these 64, 34 may not give you the accurate diagnosis. Any CT scan having 124 and above will more or less give a accurate diagnosis of a CT coronary angiogram. So many people who are 40 plus or at a risk, I advise them CT coronary angiogram. How to get it done? So first of all, CT coronary angiogram is like getting a normal CT scan. What you have to do? You need at least 4 to 5 hours of fasting. So then you book an appointment with a diagnostic centers or a hospital where they particularly do the CT coronary angiogram. There they will give some beta blockers to reduce your heart rate. To give a proper clarity, your heart rate should be less than 70. If the heart rate is more than 80, 90, 100, at the time of doing CT coronary angiogram, there will be some problems in the reporting. So they will give some beta blockers to reduce your heart rate, and they will give a contrast injection and take a CT scan, and they will report in such a way that it's like almost normal coronary angiogram where which arteries, LAD or whatever the arteries comes, tell what percentage of blocks, and your doctor will interpret if it is a significant block, then you have to go for a angiogram with your cardiologist, and if it is very insignificant or normal, at least you have to make sure that your heart is normal, you have no blockages. So these two, CT coronary calcium score, the difference is in the coronary calcium score they won't inject any dye and it is just 5-10 minutes. The CT coronary angiogram, you need a 4-5 hours of fasting. They will inject a contrast agents and it will take half an hour to 1 hour. And this is a little expensive compared to the CT coronary calcium score. And if you have very low risk, you can directly go for a coronary calcium score. If you have some little risk, I suggest you go for a CT coronary angiogram. And then comes some of the other hormonal and metabolic things. And before coming to this, when you go into CT coronary angiogram, people like pregnant women, people having kidney issues, they cannot go for this because they will inject a contrast agent that further damage your kidneys. So before that, instead of directly going for a diagnosis center, ask for it, consult your physician or a doctor, discuss with them about your risk factor, your health ailments, take the prescription, then go for this CT coronary angiograms. And then comes some routine assessments like thyroid profile, your kidney functions, homocysteine, vitamin D, vitamin B12. These are directly or indirectly related to metabolism. So when these are having abnormality, they can indirectly also affect your heart health. And some families have sudden cardiac deaths in the very young population, at the early 30s, 35s. Suddenly the people die and they don't know exactly what happened. And in such families with first degree relatives having a sudden cardiac deaths, especially younger populations, you can also, there are some tests called as lipoprotein A, ApoB and ApoP ratio, genetic cardiac markers like LDR and ApoB, PCK, these genetic cardiac markers to be done with a prescription and after discussing with a cardiologist and genetist. And these are all very rare, only in very few cases it is needed. But these are common things which for the general population. Anybody at 30 plus who having a mild risk factors can go for all these things. Because that cardiac deaths, sudden cardiac arrests are very sudden. Many times there is no time to save the people. So if you have risk factors, discuss with your physician or a cardiologist and get this test so that you can prevent these kind of sudden events. That's all.